Hi, my name is Trish, and I'm going to do some fluoride gel on my patient Chrissy today. So we're going to go over the different types of gel that you can use in a tray. This is the APF, which we typically use in a virgin mouth with no restorations. Then we have the neutral pH, which we use this more often because a lot of people have restorations. I know Chrissy has a crown. So this is the type of fluoride gel that I'm going to use today. So I'm going to apply the fluoride gel with clean hands into the tray. Notice I have the blue tray. Blue is usually for an adult patient. We have a yellow, which is for a child, or we have a white for people with small mouths, or teenagers. So I'm going to apply this. If you want to zoom in here, I'm just going to put a ribbon. We don't have to put a ton, but we just put a ribbon around here. Okay, put that away. I'm going to put my gloves on. So before I put the fluoride tray in the patient's mouth, I want to go over the reasons why we're doing the fluoride in the first place. And it's for preventative. It's a preventative method. It's going to help protect your teeth. It's kind of like vitamins for your teeth. The tooth is going to absorb the fluoride. And you want to remind the patient that it is going to be a 4-minute procedure. So it's kind of a longer procedure. It's good for them to know. You never leave the patient while you're doing this, and you also want to make sure that the patient is upright the entire time. Usually I give my patient a napkin just in case they drip. And Chrissy, if you have any, if you feel nauseous or anything, raise your hand and we'll take it right out, okay? So we're not going to do this procedure for 4 minutes. We're just going to do, sampling, so it'll probably be only 30 seconds today. So you want to have the suction available. I'm going to give the suction right to Chrissy. It's also good to inform your patient that you're not going to close down at any point on the suction because of the backflow. So just leave your mouth open, don't close on it, but you want to suck out the saliva. So you don't want to swallow the fluoride. Okay, now I'm just going to dry off the teeth. Okay. So I'm going to dry the top first, and then I'm going to do the bottom. And I'm going to have this right ready for me. Put it right in. Alright, I'll do the top and the bottom. Okay. And put the tray right in. This might be a little big for Chrissy, but this is the only one that we had. We'll cover all the surfaces of the teeth. We're going to put this right in between the teeth. You're going to tilt your head forward for me. Good. Now I'll have you hold this. Great. And now I want you to make a chewing motion with your teeth. Kind of crunch them together side to side, back and forth. You're kind of rubbing that fluoride in there. And you can kind of, her lips are, there we go. Now I get her lips over that tray there. So we're just going to give it a few minutes or a few seconds to let it do its job. Alright, so because this is just an example, we're going to take it right out. And I don't want you to close down on this. You're going to put it right back in your mouth. So she's going to suck out the excess of the fluoride. And once she's done, you want to remind the patient that they're not to eat or drink for half an hour after the procedure. They don't want to brush or floss for a half an hour as well. Do you have any questions at all, Chrissy?
No.
Okay. Do you feel like I went over everything for you? Okay.
Thank you.
Good, and that is all.